Making these videos to show that, to counter the assertion that's been made that there's no evidence for an association between Accutane and depression and suicide. That's false. That's been proven over 23 years ago by the FDA, and I'll mention that in a minute. Accutane is similar to the active form of vitamin A, which is retinoic acid. It occurs naturally in the brain, and it acts as a neurotransmitter. In fact, retinoid binding protein is the most common protein in the cerebrospinal fluid. Vitamin A is in the same class as, it's called a retinoid. It's in the same class as other medications that can cause psychiatric side effects, including thyroid hormone, glucocorticoid hormone, and sex steroids. In fact, the chemical structure of Accutane is identical to the active form of vitamin A, except it's an isomer, meaning it's a mirror image. The retinoids can go into the nucleus of the cell and bind to DNA and cause gene transcription, and that's why about 50% of people who take Accutane when they're pregnant will have the baby will have birth defects. So it's a dangerous drug, and it was originally used as a chemotherapy agent for skin cancer. All the other drugs in the supernuclear receptor superfamily, including thyroid hormone, sex steroids, and glucocorticoids, it can bind to the nucleus, and they'll have psychiatric side effects. It's been shown in animal studies by O'Reilly et al., this is in 2006 and published in the Journal of Neuropsychopharmacology, that Accutane can cause behaviors that are associated with depression and myostatin, increase in freezing type behaviors, and immobility. In fact, these behaviors are used by the pharmaceutical industry